Good afternoon. First, again, it is a great honor to continue to work with this wonderful specialty and all the volunteer leaders that give your time to it. And I also want to acknowledge the great privilege it is to work with the committed staff that we have back in the national office. As Dr. Esselman said, they're talented and they're truly committed and passionate about the specialty. So thank you for making it a wonderful place to work also. I've asked each year to give a quick overview of the activities of the national office and working with the committees. As you've heard in various conversations, our activities continue to expand and our time is short. So this is truly just a snapshot of some of the highlights. I'm not going to read all the slides. I want to leave room if there's any new business to address today. But this is also to connect some dots. Most of those committee chairs and staff are in the room, so if there's issues that you see up here, make sure you come up after the session and we can talk further about the activities. So quickly, I want to hit on some of the advocacy activities as well as the education activities. So in looking at the snapshots and advocacy, a great deal of our advocacy efforts have really evolved in wonderful ways with under the guidance of Dr. Andy Purcell and the CPT RUC activities, both kind of pursuing and advancing new CPT codes that are necessary and valuable for the specialty. And also, as you've heard also, Dr. Grierson's appointment at the RUC, who has already had a tremendous impact in terms of representing and bringing the ideas and concerns of PM&R to those conversations. A lot of the activities in 2019 were focused on the proposed changes that started in 2018 to the E&M codes and great concerns about those changes. And we were successful working both independently and in coalition with other organizations to make sure that those significant cuts did not happen. And there are changes to the E&M codes, and our focus going forward to next year is really to help educate members of those changes. Other advocacy activities that we're working on is addressing really a number of the burdens that you are all dealing with that we heard very loud and clear yesterday during the town hall, addressing the prior authorization issues and other administrative burdens. A lot of these are stemming from dialogues at the OIG report that falsely claimed that 84% of 2013 payments to IRFs were in error. We know that it's not true, but we also need to combat that with data and activity. The Academy took the lead in drafting a bill to expand the IRF 3-hour rule to include skilled modalities, specifically as prescribed by the rehabilitation team. We're working to get additional, we got a congressional sponsor, we're working to get additional sponsors before that bill is introduced. The state advocacy subcommittees have renewed energy and have been working and reaching out to the states on activities. Just to highlight a couple, they've worked in Pennsylvania with the Pennsylvania Department of Health to reverse an issue that came up in a decision that really cited 3 IRFs for not having continuous medical services, 24-hour MD services available. The state advocacy committees also worked as just an example, as well as other things in Alabama, to help head off direct PT access in the state of Alabama, and continues to work in other states. There was 2 position papers that were produced this year. One was on the definition of rehabilitation physician, and I'll come back to that one in a second. And the second one was on our position on optimizing the role of APPs in a physiatry-led team. As it relates to, you've seen a lot about this throughout the week, as it relates to the activities about the definition of rehabilitation physicians as defined in CMS code. I think in the Dr. Esselman in the presidential address, and we've talked about this elsewhere, we've done a lot of work on this. We have not won round 1, but this society has not given up in terms of our concerns and the impact that we are concerned about this going forward. There's a task force that's been formed that'll be meeting just in a couple of weeks in December that will continue to press forward. I will say that our voice was heard, and that is something that will continue to go forward. We had 1,100 members write CMS. We had 40 prestigious organizations working side by side with us. We had various meetings with different health systems, with the White House, OMB, CMS, et cetera. And we are not giving up because we're very concerned about the impact of this long term on the specialty and for your patients. So that's a snapshot. Obviously, there's a lot more going on. Also, in addition to the activities that we work on, the Academy has over 30 liaisons, member liaisons out to other organizations. Just in the clinical and technical areas, we have 65 liaisons participating in quality practice and policy review committees. So these are just a snapshot also of the different organizations. So when you support the Academy, excuse me, when you support the Academy, you're also supporting your peers going out and representing PM&R in our concerns and advancing our bold activities and plans, excuse me, Anybody else feel it's dry in Texas? Helping advance and bring the voice of PM&R to these other organizations. So, looking forward to 2020, some of the priorities in the advocacy areas will be, we're convening the multi-stake work group that I mentioned as a stage 2 on the future, looking at the future of inpatient rehab. That'll tie into further activities on the definition of rehab physicians. We're going to continue to press CMS for a number of issues that relate to denials, other administrative relief and burdens, and also the issue about non-PM&R physicians running acute rehab hospitals units. We'll have additional position statements that will be produced, including one that will come out soon on the appropriate use of the term physical medicine and rehabilitation. We're going to have increased activities at this national meeting, but also being involved in other areas and advancing our activities and our voice at the RUC and the CPT. We're going to finalize the work that's been going on for a couple of years with a multi-specialty coalition that we pulled together on a concussion writing panel, and as well as various other things that you see here, and continuing our work with CMS, expanding our resources on alternative payment models, and also we will be shortly convening a think tank to start looking at our role, the physiatry role, in documenting a position on opportunities for the physiatry role in skilled nursing facilities. As we've talked about, the clinical data registry is a very integral piece to the future plans of PM&R Bold. It is something that is, understand is something that's really integral to how it integrates with our education in the future, our publications and our research in the future, as well as our advocacy. So when we started off in 2017, we presented the goals for the clinical data registry, really about transforming the specialty, helping our members prepare for success, and dynamically engaging our members in activity. These continue to be the goals today. We stepped back last year after 2 years of collecting data to assess where we were at. We also had some changes with our vendor that we had contracted with. But in those 2 years, just to give you an example, we collected 1.7 million unique encounters with patients. And just in a small pilot first start at this, there was already some extremely valuable insights and information that was coming out of the data registry activities. What we did is we stepped back and reassessed really what were the priorities after that experience, and realized that the QCDR activities, the requirements for CMS, were not our biggest priorities. We also, I mentioned, had some vendor changes and some challenges. So the registry group has been very busy over the last year reassessing what are our priorities and what is the right vendor for moving forward. Excuse me.
I have a job now.
And we're very proud to announce that we have just completed a new agreement with a new vendor that really will propel our effort and our commitment forward on the registry. You'll be hearing a lot more about this. We want everybody to get involved down the line. I'm very excited that we have a number of very high caliber inpatient rehab facilities that will soon be entering the contracting stage and really build momentum all around. As you've heard, we started with musculoskeletal area in the terms of low back pain, as well as the rehab care continuum segment as it relates to ischemic stroke, but we will plan to move forward all across rehabilitation. We're looking at pediatrics next, but then cancer rehab, pain, and other areas as we move forward. So quickly highlighting some of the education and member services activities to wrap up. Just some updated numbers for this assembly. We have about 3,800 attendees. About 2,700 of those are physiatrists and residents. 132 sessions, you can see the breakdown there. The pavilion, all sorts of new activities and learning center activities in the pavilion. 820 abstracts were submitted and we accepted 72%. A lot of the great activity in the research hub, which was new this year. That's the highest number of submissions we've ever accepted. New this year was the research hub, where we really gave a spotlight to research. The community sessions, which seemed to be a great success, such a success that the biggest feedback concern that we've gotten is that everybody can't get to every one, and the PPC will work on that, but that's a good problem to have. Tomorrow I encourage everybody that's here, where we've had Fizz Talks in the past, we're expanding those to a brunch on Sunday morning, which is exciting, and as mentioned, the learning collaboratives have really taken a great turn this year for the positive. In addition, as we talk, we have, and above and beyond the numbers I showed you before, we have 433 medical students here. This program continues to grow every year, introducing them to PM&R. We also had 50 residency programs participate in the residency fair. Our skilled training, evaluation, and performance, our STEP programs, continue to really take off and be valued by our members. We've had great success in a great feedback on the ultrasound STEP program. Next year, and precursor this year as a pre-course, and next year kicking off will be a STEP program for spasticity. Our leadership activities, and again, these are all tied to the bold vision, the need for physiatry to continue to step forward in the leadership roles in healthcare and in your health, in your communities and in systems. Our commitment to leadership development, we have launched an online module of leadership courses. We have also launched our business administrative program in partnership with the Kellogg School of Business. We have our Future Leaders program, and we have many more sessions at the annual assembly on leadership development. Coming soon, out of the business courses will be 2 certificate programs that are being developed now, a certificate program in PM&R leadership and one in medical directorship. You've probably seen this before, but just to highlight our courses with the Kellogg School of Business will be 2 weekend courses in May and July. I really encourage you to come talk to us. These are high-level, terrific courses using the executive MBA faculty at the Kellogg School at Northwestern. Last year we had our course in navigating the opioid crisis in New York City. That course is going to be repeated in May in Nashville. This is one of the highest valued, evaluated courses that we've done. Everybody was raving about this course. We want to continue to take this broader and broader and regionally out into the field. We also last year introduced 2 regional courses for early career members in their choices in starting their practices and choosing their career path. These are going to be expanded this year with courses in Seattle and New York. And we're expanding our online offerings. There's 5 new online review courses, focused review courses online, 16 self-assessments. We've expanded and updated the Q Bank that has now 800 questions. There's PIPs for your MOC needs. We're also expanding a commitment to the instructional videos. Right now we have 4 instructional videos, and these will be expanding in the years to come with new videos every year. And as related to the APPs, there's new modules on the Me site, 9 new modules that are both for physiatrists and for APPs. For physiatrists, really understanding the value of working with APPs, what role do APPs play in a continuum, how to effectively integrate APPs in your practice, what to do and what not to do. For the APPs, are introductory courses in introducing PM&R and how PM&R is practiced, and some 101 courses for the APP audience. We've introduced an international certificate. This is for our international members who can do a knowledge assessment similar to our SAEs to receive an international certificate from the American Academy of Physical Medicine and Rehabilitation. And looking in 2020, we continue to expand and look at our business model. We will be introducing a subscription model to our on-site Me site, which with one subscription getting everything that's available there instead of the piecemealing purchasing individual products. That will still be available a la carte, but there'll also be an option to have a subscription so you can have access to everything without additional payment. Educational partnerships, we continue to have a number of partnerships across with a number of organizations, and those have expanded this year. One with a practical guide in development with about muscular sclerosis that we've worked in partnership to create, as well as other courses that have continued in the past that we continue to invest in. In GME, one of the activities in BOLD was to really brought us into the GME space. We continue with our tri-organizational efforts, working with the AAP and American Board to work on a project to really identify the future core training requirements for physiatrists, for how physiatry will be practiced in the future. As an academy, we are also working through our GME committee to work to develop specialized detailed curricula for competencies in the different clinical areas. This is not to create new program requirements. This is more aspirational curricula for the residency programs, and then allow a way for us as an academy to decide how can we lift the floor up, how can we create resources to give to various residency programs to achieve these goals that we've identified as a need for future PM&R. Wrapping up a few things on our career services. Our career services continue, our support continues to expand as there's lots of change in the marketplace. We had a wonderful job fair on Wednesday evening that continues to get larger and larger. Our FIS Forum is very active. and we'll continue to expand with the member community activity that's there. Our member communities have off to a great start. These are really grassroots, self-identified groups. We have 38 communities and 4,300 people in the first year that have already engaged in the communities with activity both here at the annual assembly as well as online. We created 2 pathways for early career physiatrists to join and become members in the academy. One is a practice pathway when you go right out into practice. Another one is a fellowship pathway. This is really incentivizing and providing a nice, smooth pathway for members coming out of residency who either go straight into practice or through fellowships to keep their membership and enhance their membership in the academy. And lastly, plans are well underway and many completed for 2020 in terms of our activities in San Diego. There is opportunity right now to register here at this meeting and get a savings. I encourage all those that plan to be there in San Diego and also plan to join us at the President's reception next year on the historical USS Midway. So we look forward to seeing you next year. Thank you.